Renate Pore, Dr. Renate Pore. She's the interim executive director of the West Virginians for Affordable Healthcare, and she's also the director of policy for the West Virginians for Affordable Healthcare. Some of you might remember that she was the director of the Governor's Healthcare Planning Commission and Cabinet on Children and Families. She was one of the founders of Healthy Kids and Families Coalition and the West Virginia Center on Budget and Policy. She's the most well-informed person I know about healthcare coverage in this state. So welcome, Dr. Renate Pore.
I want to compliment my colleague, Seth. He's a scary person, but he's very nice, and the work they do at the Center on Budget and Policy is really extraordinary. We are very lucky. I think the center has been around since 2008 we started, and the work they put out is really phenomenal. So, Seth was scary, but I hope I can really scare you. I want to introduce to you my colleague, Dora Selko, who actually lives in this part of the state, and she's worked with West Virginians for Affordable Healthcare for about 6 years. So I think maybe it was about 8 or 10 years ago, Perry Bryant and I think Dan Doyle organized this meeting. We met in Fayetteville, wasn't it about that? And we talked about healthcare and...
That was the inaugural meeting of Fayette County.
Oh, that was the inaugural meeting.
And it was probably about February 2009.
And we talked about what a shame a great country like ours doesn't have health insurance coverage for everybody. Right? That was one of our topics, and we pledged ourselves to work for that. Well, lo and behold, in 2010, a miracle happened. Really, it was a miracle that the Democratic Congress and Barack Obama could pass the Affordable Care Act without any Republican support. The Affordable Care Act now passed in March of 2010, so it's almost 7 years now. It got off to a slow start. It's very complicated. Lots of people don't understand it. The Republicans branded it as Obamacare and said it was terrible. It took away your choice, took away your doctor, raised your insurance costs, and all those kinds of lies. And that's what they were, lies. But nevertheless, we had the law, and we made progress. 2010, when the law was passed, things like you could be denied insurance coverage because you had a pre-existing condition. That went away. Lifetime limits on what an insurance company would pay for your illness, that went away. Young adults could stay on their parents' policy up to age 26, no matter what their circumstances. They didn't have to be students. The donut hole for seniors. I don't know if there are any seniors here with high drug costs. The donut hole started to shrink, and by 2020 it's supposed to go away entirely so that seniors with high drug costs don't have to pay out of their pocket. And then, in 2014, the really big stuff happened. We expanded Medicaid. More than 175,000 West Virginians signed up for Medicaid in that first year. Yes. 35,000 West Virginians signed up for a private health insurance policy in the marketplace, and most of those, 86%, got financial assistance to buy a Blue Cross Blue Shield policy. People are getting preventive care without having to pay out of their pocket to get in the door. Women who hadn't had a mammogram for years went and found out they had a lump in their breast. And there are just stories after stories after stories about how this has helped everybody in America, but especially in West Virginia. West Virginians have benefited more from the Affordable Care Act than any other state. But right now, as we sit here, it's about to be yanked out from under us. And I can't tell you how serious this is. The Congress has already voted once to repeal. They did it in budget resolution, and I won't go into the technicalities of that, but it sets it up for repeal. They had hoped to have a repeal the entire Affordable Care Act to the President on Inauguration Day. They didn't achieve that. They're finding that healthcare maybe is a more heavy lift than they had anticipated, and they're having a hard time finding consensus about repealing the Affordable Care Act without having a replacement. We've had a message out there to our senators and our representatives in the House saying, do not repeal without replace. Imagine the harm that you will do in West Virginia. And it's not just people who will lose their insurance coverage who will lose. It's also the federal dollars. We were just talking about the budget here. The Medicaid expansion itself brought in more than $700 million new federal dollars the first year. $700 million new federal dollars. That supports your rural hospital, your community health center, your mental health services. The first year of the Medicaid expansion, we had $43 million new federal dollars for substance abuse treatment in West Virginia. And you all know how much we need that. We need way more than $43 million. But it was a huge step forward. Doris passed out this, what's at stake for West Virginia? This is just, you know, the top stuff. What's at stake? Almost 200,000 West Virginians stand to lose their coverage in Medicaid, and others in the marketplace. It will cause a ripple effect across the state's economy as we lose that $700 to $800 million a year, that now federal money that goes for health care. If you have private health insurance, repeal of the act would mean they could go right back to discriminating against people with pre-existing conditions. They can impose lifetime limits, annual limits. They can start selling those skinny healthcare policies that really don't buy you anything. They just take money out of your pocket, but if you ever had tried to use one of those policies, you knew that they were practically worthless. Free preventive services that you get now would be lost. Insurance companies, one of the really positive things about the Affordable Care Act, it put insurance company profits at 15%. Before the Affordable Care Act, insurance companies could take whatever they wanted off the top and then pay out whatever they wanted. Now, the law is that if you are an insurance company, 85% of the money you take in, you have to pay out for medical care. The profits and administrative costs are restricted to 15%. That protection would be lost. And thousands of seniors, and our data is that approximately seniors in West Virginia have saved approximately $221 million on drug costs because of the Affordable Care Act. All that would be lost. Now, of course, the Congress is no longer saying they're just going to repeal it. They are going to replace it. And actually, the newest message today out of the Congress is, well, I think we should repair it. So, which is a good step in the right direction. We've always said, don't nix it, fix it, you know. The Affordable Care Act does need some fixing, for sure. So now they're going to talk about fixing it, but I would be very, very wary about what comes out of the Congress on their proposed solutions. And so, unlike Seth, that organization, they're all young people, they're so tech savvy and so smart and slick. I don't have a website that you can go to, but Doris passed out an old-fashioned sign-up sheet. You can sign up and you can check whether you want, if you want to be on our e-list. We do have e-lists and we can send out messages. We are that sophisticated. You will hear from us about when you need to contact your senators and your representatives in Congress and say, well, you think, is this bill really going to maintain coverage for 97% of West Virginia's children that have coverage now? Is this going to erode coverage for West Virginia? And we will send you messages to ask those questions. And the next the next 6 months are going to be so critical. And our senators, we've met with both Senator Capito and Senator Manchin. They're very concerned about not doing harm to West Virginia. But they need to be educated and they need to hear from you. So, sign up and we will send you messages and tell you what we need you to do. And Doris just made these wonderful bookmarks. I don't know if they're too big to stick in your shirt pocket. But on the back is the address and phone number of every member of Congress. Call them often. Tell them what your concerns are. If you know of somebody who has benefited from the Affordable Care Act, tell them. They want to hear from you. They want to hear these stories. And on the back, in small print, may need your magnifying glass, I know I do, are what we as a consumer voice for healthcare in West Virginia, we have developed these principles for replacement. Okay, repair the Affordable Care Act, but these are principles that must be incorporated into the repair. We do not want to lose coverage. 97% of West Virginia kids are covered through Medicaid, CHIP, or private insurance. We don't want to lose any of them. 93% or 94% of all West Virginians are covered. That's like a 50% decrease from where it was before 2014. Here's another thing we're going to be messaging you. They want to turn Medicaid into a block grant. You know what that means? That means less money for West Virginia. A block grant gives you, right now, Medicaid is an entitlement. We have a very favorable federal match, which is very good for our state. So, approximately, for every state dollar we spend, the federal government gives us $3. It's about a 75% match, the best in the country. Wow. We want to continue that. We don't want a block grant where they give us, okay, West Virginia, here's $3 billion. This is what they're going to offer. And just take it and, spend it the best you can. And next year we're going to also give you $3 billion and take it and spend it the best you can. It won't be an entitlement anymore. We will have to live within what will become a tighter and tighter budget as the years go by. And some people have estimated that within 10 years we would lose 35% of Medicaid funding in West Virginia under a block grant scenario. So we don't want block grants. We've already told Senator Capito and Senator Manchin be very bad for West Virginia. The other thing I think that nobody has paid much attention to under the Affordable Care Act. The Affordable Care Act wanted to take America from a sick healthcare system, where we only focus on sickness, to a healthcare system, a prevention-oriented system. That's a fundamental piece of the Affordable Care Act. We want to keep the emphasis on prevention and try to keep people healthy and not impose a financial barrier to see a doctor. And that's especially true for children who really have unique developmental needs that should be met, and if we don't meet them, it is at our peril as a society to allow kids not to have their needs met when they are younger. So, take one of these. It's very simple to you just call up and say, I'm going to leave a message for Senator Manchin, and the message can be as simple as, I'm really worried about what's going on in Congress, and I hope that you're going to protect the interests of West Virginians who have insurance coverage now, and also the economic benefits that we get from our good federal match. And there'll be other messages as we move forward. So, do I need to say anything else?
We might want to give him Alex Mooney's phone number.
Oh!
He's on ours.
He's on yours.
He's not there.
We've got Jenkins.
Yeah, you have Jenkins.
We have Jenkins.
Yeah, well, you don't need to worry about Alex Mooney. Don't call Alex Mooney.
Well,
Call
they won't take your call if you're not in their district, so.
You call Evan Jenkins.
But do call Evan Jenkins and visit with him when he's in town and share your concerns with him. So, let me just ask, is there anybody here who, and here's what they really like. They really like to hear from people who have benefited from the Affordable Care Act. And the more people we can get out there who will tell their story, the better it will be to get a bill that will continue the protections that we have now.
So is the sign up our action? Is that our action item?
The action item is call them, tell them you're concerned, sign up my sheet, that's 2 actions. And if you do have a story, your personal story or a relative or friend, and if they would be willing, if you'd be willing to share it, let us know and let the senators know. And really you should contact Jenkins too, but right now the action is really in the Senate. And Senator Capito is really a very important person in the debate.
Thank you to our sponsors, Our Children, Our Future, the Fayette County Family Resource Network, the Southern Appalachian Labor School. This presentation was provided by Fayette Fair Share. Please like us on Facebook.